Hello everyone, I am Dr. Shankar Dey. Welcome to 6th video of NEET-PG 2022 recall question discussion. So starting with question number 51, which of the following is autosomal recessive in inheritance? As all of you know, among these four options, autosomal recessive is cystic fibrosis. So cystic fibrosis is autosomal recessive disease associated with CFTR gene. So cystic fibrosis, achondroplasia is not autosomal recessive, it is autosomal dominant, not Huntington disease, not also Treacher-Collins disease. So among these four options, cystic fibrosis is the correct answer for autosomal recessive disease. Next, coming to question number 52, gynecologist counseled her female patient about hysterectomy and discusses about the advantage and disadvantage of this procedure. So gynecologist counsel his patient about the full advantage and disadvantage of the procedure before going to the actual surgery. So which type of consent is this? This is called informed consent, because the patient has been informed fully about the type of surgery and advantage and disadvantage before going to the surgery. This is informed consent. So here the answer is informed, not blanket, implied or silent. It is informed consent. At what level uterus is failed on the second day of post delivery? On the second day of post delivery, uterus usually failed 2 finger below the umbilicus. This is the answer, 2 finger below the umbilicus. Next, coming to question number 54, a middle aged male with painless slow growing neck swelling. So neck swelling, slow growing, painless, lymph node involvement is there, surgery done and biopsy image is given. So see here the typical biopsy image. This is showing some features, typical features of orphan ani nuclei. So orphan ani nuclei, this is seen in which cell of, in which type of carcinoma of thyroid? This is seen in papillary thyroid carcinoma. So this is typical pictures of orphan ani nuclei, one cartoon character suggestive of papillary thyroid carcinoma. So let's now go for the options. So which one is not true about this pathology or papillary thyroid cancer? First of all, nuclear features are the characteristic of this tumor. Obviously this is true, because nucleus features, orphan ani nuclei is the most specific and characteristic features of this tumor. FNAC is not diagnostic. This is false, because FNAC is not only diagnosis but confirmatory. Spread of this tumor is through lymphatics. This is also true. It can be metastasized through lymphatics. It has excellent prognosis. This is also true. Papillary thyroid cancer has excellent prognosis. So the which one is not true about papillary thyroid cancer? The answer is FNAC, not diagnostic. FNAC is diagnostic for papillary thyroid carcinoma, but FNAC cannot rule out between which type of thyroid cancer? That is which type of cancer? Follicular variety of thyroid cancer. It cannot differentiate follicular adenoma and follicular variety of thyroid cancer. Next, coming to the 55 number question. Question was lots of iron tablet intake, in history of lots of iron tablet ingestion, following which patient presented with features of pain abdomen, profound GI bleeding, letharginess and in comatose condition. So this is features of iron toxicity. So preferred treatment for this case, as all of you know, antidote of iron toxicity is desferrioxamine, iron chelator. So the answer will be desferrioxamine, not British antiloxide or penicillamine or activated charcoal. It is desferrioxamine is the preferred treatment for iron toxicity. Coming to the question number 56, identify the histological structure mark. See here, this structure is marked, this structure is marked. What is this? This is the histological picture of pancreas. Pancreas, as all of you know, pancreas is a mixed type of gland. It has both exocrine part and endocrine part. This is the exocrine part of the pancreas, and this is the mark structure is the endocrine part. What is the name of this endocrine part of pancreas? It is known as islets of Langerhans. Islets of Langerhans. So islets of Langerhans. So the question asks is islets of Langerhans, endocrine part of the pancreas, and this is the blood vessels. Coming to the question number 57, identify the marked zone. So this star marked area was asked. So what is this? This is actually mid pelvis. From here to here, this is mid pelvis. Okay, so the mid pelvis from upper level of the S3 to lower level of the S4. This part is from mid pelvis, obstetric conjugate, anatomical conjugate to S3 S4 is mid pelvis. Next, coming to this question number 58. Patient presented with some features of raised LDH, elevated bilirubin and hemoglobinuria. This is definitely suggestive of hemolytic disease or hemolytic anemia, and peripheral blood smear is also shown. See here, presence of some cell. This is called helmet cell. See here, helmet cell, also called cystocytes. So these are all cystocytes or helmet cell. So this is definitely case of hemolytic anemia, microangiopathic hemolytic anemia. So microangiopathic hemolytic anemia or MAHA, MAHA. So let's now go for the option. Which of the following will be seen in this scan? Goiters? No. Goiters not seen in microangiopathic hemolytic anemia. Raised hemoglobin A2? No. Splenomegaly? No. Mechanical second heart sound? Yes, it can be heard because sometimes prosthetic heart valve can cause microangiopathic hemolytic anemia. So this prosthetic heart valve causing microangiopathic hemolytic anemia can be mechanical second heart sound can be heard or auscultated. So the answer is mechanical second heart sound in case of microangiopathic hemolytic anemia due to prosthetic heart valve. Okay. Next, coming to question number 59. Patient presented in ER with history of intake of 20 paracetamol tablet. So treatment of choice, as all of you know, the antidote of choice for treatment of choice for paracetamol is obviously NAC, N-acetylcysteine. Okay. Coming to question number 60. 10-month-old child presents with edema anasarca. This age may not be right. So child with anasarca and edema, diagnosis of minimal change disease has been made. And what is true about this disease? This was, I think this was asked. What is the true statement? Respond well with steroid. This is true because minimal change disease respond well with steroid. Light microscopy showed effacement of podocyte. This is false. Obviously this effacement of podocyte is seen in MCD but not with light microscopy. This is seen with only with electron microscopy. As all of you know, this MCD is also known as Neal disease. Why it is Neal disease? Because no features is seen in light microscopy and immunofluorescence. That's why it is also known as Neal disease. Only effacement of podocyte can be seen with electron microscopy. Common in adults, obviously no, this is more common in children. Next, non-selective proteinuria, no, it is present with selective proteinuria. So the only true statement about this disease, it responds well with steroid. So this is the right answer, MCD respond well with steroid. So in the next video, I am going to discuss question number 61 to 70. Question number 61 to 70. So stay tuned for the next video and don't forget to subscribe my channel, Dr. Shankar Dey. Thank you very much for watching.